Public health is all about protecting and improving the health of communities through education, policymaking, and research for disease and injury prevention. Unlike clinical medicine, which focuses on treating individuals, public health works at the population level. It aims to prevent problems before they happen, promoting healthy lifestyles and environments. From clean water initiatives to vaccination programs, public health efforts touch our lives every day. Understanding public health helps us see how society works together to keep everyone safe and healthy. In this video, we'll explore the basics of public health and how it connects to epidemiology, the science behind tracking and controlling diseases. Epidemiology is the branch of public health that studies how diseases spread, who gets them, and why. It's often called the cornerstone of public health because it provides the data and analysis needed to make informed decisions. Epidemiologists investigate outbreaks, identify risk factors, and recommend ways to control or prevent health problems. By understanding patterns and causes of diseases, they help shape policies and interventions that protect entire populations. Epidemiology isn't just about infectious diseases, it also covers chronic illnesses, injuries, and even environmental health issues. Main goals of public health are to prevent disease, prolong life, and promote health through organized efforts. This means working to reduce health disparities, ensuring access to healthcare, and creating environments where healthy choices are easier. Public health professionals focus on everything from sanitation and vaccination to education and policy advocacy. Their work is guided by data and research, often provided by epidemiologists. By understanding these goals, we can appreciate the broad impact public health has on our daily lives and the well-being of our communities. Public health has a rich history, dating back to ancient civilizations that recognize the importance of clean water and sanitation. Over time, major milestones like the development of vaccines, improved hygiene, and the establishment of health agencies have shaped public health as we know it. The field has evolved to address new challenges, from infectious disease outbreaks to chronic conditions and environmental threats. Understanding this history helps us see how public health strategies have adapted and why they remain crucial today. Epidemiology emerged as a scientific discipline in the 19th century, with pioneers like John Snow, who famously traced a cholera outbreak in London to a contaminated water pump. This marked a turning point in understanding how diseases spread and how to control them. Since then, epidemiology has grown to include sophisticated statistical methods and technology, allowing researchers to track diseases in real time and respond quickly to new threats. The field continues to evolve, playing a vital role in public health today. Public health operates through several key functions: assessment, policy development, and assurance. Assessment involves collecting and analyzing health data to identify problems. Policy development means creating strategies and laws to address those problems. Assurance ensures that services are provided and that policies are implemented effectively. These functions work together to create a comprehensive approach to health, ensuring that communities are protected and supported at every level. Epidemiologists use different types of studies to investigate health issues. Descriptive studies look at the who, what, when, and where of diseases. Analytical studies dig deeper, exploring why and how diseases occur by comparing groups. Experimental studies like clinical trials test new treatments or interventions. Each type of study provides unique insights, helping public health professionals make evidence-based decisions. Understanding these study designs is key to interpreting research and applying findings to real-world problems. Descriptive epidemiology focuses on describing the distribution of diseases within a population. It answers questions like who is affected, where cases are occurring, and when outbreaks happen. By mapping out these patterns, public health officials can identify trends and potential risk factors. This information is crucial for planning interventions and allocating resources effectively. Descriptive studies often use data from health records, surveys, and surveillance systems to paint a clear picture of public health challenges. Analytical epidemiology goes beyond description to investigate the causes of health problems. It compares groups to determine risk factors and test hypotheses about disease origins. For example, researchers might compare people who got sick with those who didn't to see what exposures or behaviors differ. Analytical studies help identify what's driving an outbreak or why certain populations are at higher risk. This deeper understanding guides targeted prevention and control strategy. Experimental epidemiology involves actively testing new interventions, such as vaccines or treatments, to see if they work. This is often done through randomized controlled trials, where participants are assigned to different groups to compare outcomes. These studies provide the strongest evidence for cause and effect, helping public health officials decide which strategies are most effective. Experimental epidemiology is essential for advancing medical knowledge and improving health outcomes. Prevalence is a core activity in public health, involving the continuous collection, analysis, and interpretation of health data. It helps detect outbreaks early, monitor trends, and evaluate the impact of interventions. Surveillance systems track everything from infectious diseases to chronic conditions and injuries. By staying alert to changes in health patterns, public health officials can respond quickly and effectively to emerging threats. When a disease outbreak occurs, epidemiologists jump into action to find the source and stop its spread. Outbreak investigations follow a systematic process, confirming the outbreak, identifying cases, collecting data, and analyzing patterns. Investigators look for common exposures or risk factors among those affected. Their findings guide public health responses, such as issuing warnings, recalling products, or launching vaccination campaigns. Quick and thorough investigations are key to protecting communities. Public health uses a variety of strategies to prevent disease, from promoting healthy behaviors to implementing vaccination programs. Prevention can be primary, like stopping a disease before it starts, secondary, like early detection through screening, or tertiary, like managing symptoms to prevent complications. These strategies work together to reduce the burden of illness and improve quality of life for everyone. Vaccination is one of the most effective public health tools for preventing infectious diseases. By immunizing large portions of the population, vaccines create herd immunity, protecting even those who can't be vaccinated. Vaccination campaigns have led to the eradication or control of diseases like smallpox, polio, and measles. Ongoing research and public education are essential to maintaining high vaccination rates and preventing outbreaks. Screening programs are designed to catch diseases early, when they are easier to treat and less likely to cause serious harm. Examples include mammograms for breast cancer and blood pressure checks for hypertension. Early detection allows for timely intervention, improving outcomes and reducing healthcare costs. Public health agencies promote screening through education and access to services, making it a key part of disease prevention. Health promotion involves encouraging people to adopt healthy behaviors, such as eating well, exercising, and avoiding tobacco. Public health campaigns use media, community programs, and policy changes to make healthy choices easier. By addressing the social and environmental factors that influence health, promotion efforts help prevent disease and improve overall well-being. Health promotion is a proactive approach, empowering individuals and communities to take charge of their health. Environmental health is a key part of public health, focusing on how our surroundings impact our well-being. This includes clean air and water, safe housing, and protection from toxins. Public health professionals work to identify and reduce environmental risks such as pollution or unsafe food. By improving environmental conditions, we can prevent many diseases and promote healthier communities. Social determinants are the conditions in which people are born, grow, live, work, and age. These factors like income, education, and access to healthcare have a big impact on health outcomes. Public health aims to address these determinants by reducing inequalities and improving opportunities for all. By tackling root causes, we can create healthier, more equitable societies. Chronic diseases like heart disease, diabetes, and cancer are leading causes of death worldwide. Public health works to prevent and manage these conditions through education, screening, and policy changes. Efforts include promoting healthy diets, encouraging physical activity, and supporting tobacco cessation. By addressing risk factors and supporting those with chronic illnesses, public health reduces the burden on individuals and healthcare system. Controlling infectious diseases remains a top priority for public health. This involves surveillance, vaccination, outbreak response, and public education. Rapid detection and response are crucial to stopping the spread of diseases like influenza, tuberculosis, and COVID-19. Public health agencies work with communities, healthcare providers, and governments to coordinate efforts and keep populations safe. Public health isn't limited by borders. Global health initiatives address issues like pandemics, malnutrition, and access to clean water worldwide. Organizations such as the World Health Organization coordinate international responses and share knowledge. Working together across countries helps control diseases, improve health systems, and promote equity on a global scale. Health policy shapes the laws and regulations that impact public health. Advocacy involves speaking up for changes that improve health, such as banning smoking in public places or mandating seatbelts. Public health professionals use evidence from epidemiology to support policy changes and educate decision-makers. Effective advocacy leads to safer, healthier communities for everyone. Communicating health information clearly and effectively is essential for public health. This includes everything from warning about outbreaks to promoting healthy habits. Health communication uses media, social networks, and community outreach to reach diverse audiences. By providing accurate, timely information, public health professionals help people make informed decisions and protect themselves and others. Data is the backbone of public health and epidemiology. Collecting, analyzing, and interpreting data allows professionals to identify trends, measure progress, and evaluate interventions. Reliable data helps target resources where they're needed most and supports evidence-based decision-making. Advances in technology have made it easier to gather and share health data, improving our ability to respond to public health challenges. Biostatistics is a key tool in epidemiology, providing methods to analyze health data and draw meaningful conclusions. Statistical techniques help determine if observed patterns are real or due to chance. Biostatisticians work closely with epidemiologists to design studies, analyze results, and interpret findings. Their work ensures that public health decisions are based on solid evidence. Ethical considerations are central to public health and epidemiology. Professionals must balance individual rights with the needs of the community, ensuring that interventions are fair and respectful. Issues like privacy, informed consent, and equity are always top of mind. Ethical guidelines help protect participants in research and ensure that public health actions are just and transparent. Public health workforce includes a wide range of professionals: epidemiologists, health educators, environmental health specialists, and more. Each plays a unique role in protecting and promoting health. Collaboration is key as teams work together to address complex challenges. Investing in training and resources ensures that the workforce is prepared to respond to current and future health threats. Engaging communities is essential for successful public health initiatives. This means listening to local needs, building trust, and involving people in decision-making. Community engagement leads to more effective programs and greater acceptance of interventions. By working together, public health professionals and communities can create lasting change and healthier environments. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. Public health works to eliminate barriers like poverty, discrimination, and lack of access to care. Achieving health equity requires addressing social determinants and ensuring that resources are distributed fairly. It's a fundamental goal of public health, guiding policies and programs at every level. Being prepared for emergencies, like natural disasters, disease outbreaks, or bioterrorism, is a key part of public health. Preparedness involves planning, training, and coordinating resources to respond quickly and effectively. Public health agencies develop emergency plans, conduct drills, and work with partners to ensure communities are ready for any situation. Effective preparedness saves lives and reduces the impact of crises. Strong health systems are the foundation of effective public health. This means having well-trained staff, reliable infrastructure, and efficient processes. Strengthening health systems improves access to care, quality of services, and the ability to respond to health threats. Public health professionals work to build capacity, support innovation, and ensure that systems are resilient and adaptable. Technology is transforming public health and epidemiology. Tools like electronic health records, mobile apps, and data analytics make it easier to track diseases, communicate with the public, and deliver care. Technology also supports research, education, and collaboration across borders. Embracing innovation helps public health professionals respond to challenges more quickly and effectively. Behavioral health addresses mental health and substance use, both of which are critical to overall well-being. Public health works to prevent and treat behavioral health issues through education, support services, and policy changes. Reducing stigma and increasing access to care are key goals. By integrating behavioral health into public health, we can improve outcomes for individuals and communities. Protecting the health of mothers and children is a top priority for public health. Programs focus on prenatal care, nutrition, immunizations, and safe environments. By supporting families and addressing risks early, public health helps ensure healthy pregnancies and childhoods. Maternal and child health initiatives have led to lower infant mortality rates and better long-term outcomes. As populations age, public health faces new challenges and opportunities. Older adults may have unique health needs, such as managing chronic conditions or preventing falls. Public health programs promote healthy aging through screenings, physical activity, and social support. By addressing the needs of older adults, we can help people live longer, healthier lives. Injuries are a major public health concern, from car accidents to falls and violence. Prevention strategies include education, safer environments, and policy changes like seat belt laws. Public health professionals analyze data to identify risk factors and develop targeted interventions. By reducing injuries, we can save lives and lower healthcare costs. Occupational health focuses on keeping workers safe and healthy. This includes preventing injuries, reducing exposure to hazards, and promoting wellness in the workplace. Public health professionals work with employers and employees to identify risks and implement safety measures. Healthy workplaces benefit everyone, leading to higher productivity and better quality of life. Good nutrition is essential for health at every stage of life. Public health promotes healthy eating through education, food policies, and community programs. Efforts include improving access to healthy foods, supporting breastfeeding, and addressing food insecurity. By making nutritious choices easier, public health helps prevent chronic diseases and supports overall well-being. Access to clean water and proper sanitation is a basic public health need. Contaminated water can spread diseases like cholera and dysentery. Public health efforts focus on improving water quality, building sanitation infrastructure, and educating communities. Safe water and sanitation save lives and are fundamental to health and development. Air pollution is a major environmental health risk, linked to respiratory diseases, heart problems, and even cancer. Public health works to monitor air quality, reduce emissions, and educate the public about risks. Clean air initiatives protect vulnerable groups like children and the elderly, improving quality of life for everyone. Vector-borne diseases like malaria and dengue are spread by insects such as mosquitoes. Public health strategies include controlling vectors using bed nets and educating communities about prevention. Surveillance and rapid response are key to stopping outbreaks. By reducing exposure to vectors, we can protect populations from these serious diseases. Zoonotic diseases are infections that spread from animals to humans, such as rabies and COVID-19. Public health monitors animal populations, investigates outbreaks, and educates the public about risks. Collaboration between human and animal health sectors is essential for preventing and controlling zoonotic diseases. Laws and regulations are powerful tools for protecting public health. Examples include seat belt requirements, smoking bans, and food safety standards. Public health professionals work with lawmakers to develop and enforce policies that keep communities safe. Legal frameworks provide the authority and structure needed to implement effective health interventions. Measuring the impact of public health programs is essential for improvement and accountability. This involves tracking health outcomes, evaluating interventions, and using data to guide future efforts. Success is seen in reduced disease rates, longer life expectancy, and improved quality of life. Continuous evaluation ensures that public health remains effective and responsive to changing needs. Public health and epidemiology will continue to evolve as new challenges and opportunities arise. Advances in technology, global collaboration, and a focus on equity will shape the future. By staying adaptable and committed to evidence-based practice, public health professionals can protect and improve health for generations to come. The journey is ongoing, and everyone has a role to play in building healthier communities.